In this video, we're looking at the heart. Now, as you see it positioned here is pretty much how it resides in your chest. About 2/3 left of midline and 1/3 to the right of midline. So, the heart is a 4-chambered pump. It has 2 superiorly located smaller chambers called atria. Singular would be atrium. This is your right atrium, left atrium. And then 2 larger chambers called ventricles. This will be your right ventricle, and this will be your left ventricle. The ventricles have myocardium, cardiac muscle. It's a powerful muscle to pump blood, but it's a living tissue, and like all living tissues, it needs to be fed. So let's look at the vascularization that both feeds this myocardium and then gathers the now deoxygenated blood and returns it to the heart. So this first red vessel you see here is called the anterior interventricular. Inter means between, so it's between the ventricles on the anterior of the heart. Pretty simple. It's also known as the left anterior descending artery, and it's branching off the left coronary artery. Now, in this view, we can't see the left coronary artery because it's behind this pulmonary trunk. But the left coronary artery, or LCA, is branching directly off the ascending aorta right here, just past the aortic semilunar valve, which we will see a little later in the video. Once it clears this pulmonary trunk, it branches into the left anterior descending and to the left lateral aspect here, the circumflex artery. And it'll continue around the back, feeding aspects of the posterior of the heart. On the right side, we see the right coronary artery. And just like the LCA, the RCA branches off the aorta just past the aortic semilunar valve. It'll feed the entire free wall of the right ventricle, and then it'll wrap around and also feed posterior aspects of the heart. Now, if we have arteries bringing blood to the myocardium, we have veins that have to drain that blood from the myocardium. So this large vein here that parallels the interventricular artery is called the great cardiac vein. It will continue around the lateral aspect, merging with this vessel that parallels the circumflex artery and draining the left wall of the left ventricle. And they will merge together, forming this large coronary sinus where posterior vessels will also enter. And this coronary sinus will dump directly into the right atrium. Now, this is the posterior of the right atrium, and here you can see the inferior vena cava. So kind of make a mental note of that, because when I show it to you from the anterior, it won't be as easy to see the inferior vena cava. Let's turn this back around now and look at some of the other structures coming off the heart, larger vessels. So here we have the superior vena cava, and as I just showed you, the inferior vena cava. These are the 2 largest veins of the body. The superior is draining the upper body, upper limbs, the head. The inferior is draining the lower extremities, the abdomen, the digestive tract, and bringing blood back to the heart. The blood that it's returning to the heart is deoxygenated. So as that blood comes back to the heart, it enters the right atrium. Now I'm going to take this off, which is the anterior of the heart, so that we can see these internal aspects of these chambers. So here you see the superior vena cava, and again the inferior vena cava coming in from the bottom here, and they're dumping into the right atrium. From there they pass through this structure. This is your tricuspid valve. And all valves prevent the backflow of blood. So blood will go through the tricuspid into the right ventricle, from the right ventricle up through here. This is your pulmonary semilunar valve. And from there it will go into that pulmonary trunk. Now I'm going to turn this around to a posterior view. So since this is the posterior, you know now this is the left and this is the right. So that pulmonary trunk will branch then into the left pulmonary arteries and the right pulmonary arteries, taking deoxygenated blood to the lungs to drop off CO2, pick up O2. And it'll return to the heart through these 4 pulmonary veins. Now notice the color. Veins are usually oxygen poor. But the pulmonary veins are the only veins in your body that are oxygen rich because they're returning from the lungs having just picked up oxygen. All the arteries of your body are red, denoting that they're oxygen rich. But the pulmonary arteries are blue because they're oxygen poor. They're bringing that venous blood back from the body to go to the lungs and get oxygen. So this is actually the posterior of your left atrium as well. So as the blood returns from the lungs into the left atrium through the 4 pulmonary veins, it then will transport through this, which is your bicuspid valve, sometimes called the mitral valve, into your left ventricle. And when the left ventricle contracts, it will send the blood here up through the aortic semilunar valve. Now, if you recall, I mentioned this earlier. So there's your left coronary artery coming off the ascending aorta right here, but it's behind the pulmonary trunk. And then on the other side, there is the right coronary artery coming off the ascending aorta. And again, just past that aortic semilunar valve. Now, if we look here, you see this little white structure right here. We'll talk about this again when we do systemic circulation and fetal circulation, but that's called the ligamentum arteriosum. It's collapsed now in the adult heart, and it's just a fibrous ligamentous connection between the pulmonary trunk and the aorta. But in fetal circulation, this was open. It was called the ductus arteriosus, and it was a bypass because in fetal circulation, the lungs aren't working while the baby is in utero. So if blood does go through the pulmonary trunk, which it should not, it doesn't make it to the lungs. It goes from the trunk right into the aorta and out to the body to feed the body. And this is the difference. I showed you that coronary sinus in the posterior of the heart when we were looking at the cardiac veins. This is the opening of that sinus into the right atrium. This right here is a remnant scar called the fossa ovalis, but in fetal circulation, this was a natural opening called the foramen ovale. And as blood came to the right atrium from the umbilical veins, because remember now in fetal circulation, the placenta is the organ of gas exchange, not the lungs. They're not working yet. So now oxygen-rich blood comes from the placenta. It gets into the inferior vena cava. We'll see this in fetal circulation. And instead of going into the right ventricle, it goes through the foramen ovale into the left atrium, left ventricle, and through the aorta and out to the body to feed the body. Again, this is a bypass of the lungs in fetal circulation because they don't work. So foramen ovale becomes the fossa ovalis at the time that we are born. Take our first breath, this closes. And then it's very sticky, so it stays closed, and it will epithelialize and scar over, and it is forever the fossa ovalis. And again, this white structure right here is in the adult heart the ligamentum arteriosum, but in fetal circulation, it's the ductus arteriosus. So we'll look at that again when we cover fetal circulation. So that's your heart, external structures, coronary circulation, internal structures. And if you were paying attention as we open this up, we were actually following the flow of blood through the heart to the lungs and back and out to the body. So there you go. Lub-dub, the heart.